Missed our latest webinar? No worries. We know life gets busy, but your professional development shouldn't have to wait. That's why we've created webinar micro lessons. Short, focused recaps of our full sessions designed to help you catch up quickly and still earn your CPD points. These bite-sized lessons are available exclusively to active subscribe members. So even if you miss a live session, you never miss out on the knowledge or the CPD points. Not subscribed yet? Now's the perfect time to join. Get access to all future webinars, every micro lesson, and more. Visit www.clinicalcareplatform.com to sign up.
Yay! This thing caught me by surprise. I was not ready. How are you, colleagues? I hope you are well. It's a Monday, and I know Mondays are generally hectic for most of us, but I hope you are well. I feel a bit better. I got some people writing me WhatsApp. I say, "Hey, Thursday, you look tired." I was exhausted because for most of that week I was traveling between Joburg and Middleburg in the morning and then coming back, training young doctors on advanced HIV management. So yeah, it got me a bit exhausted, but yeah, I'm happy to be here. I can never prefer to be anywhere else at this time. I think I always believe in divine moments, and every evening I know that someone is going to be impacted positively. In as much as every time when I'm here, I see myself becoming better and better as an individual. So I'm quite excited to host you. So today is just a 30-minute session. It's an information session about the nurse-initiated ART management. And it's an information session, especially for those who are either interested to join us in person. Next week, we have a 5-day in-person workshop. We do have other ways of hosting a NIMART training program, including e-learning self-paced, but we know that there's people who just don't like learning via technology, and they would prefer to have in-person events. As the clinical care platform, we haven't done much in that space, but because we have absorbed our school, Aqua Training School, I thought we should resume what the school was meant to be and integrate some in-person events in between. All right, so thank you very much for joining us. Let me find a way to share my screen. I want to do it a little bit differently. Where am I now? I don't know what you guys are seeing. Oh, I should get to the slides. Yay. Yeah, now I got it. I hope you can see the slides. They might be a bit blurry, but it's okay. So yeah, so tonight I want us to look at NIMART and just to share a couple of things. So you can see that we have now two brands. We have the Academy for Quality Healthcare, which is something we are building. to provide some of the accredited programs. So in the next couple of months, you should hear a lot that is going to be offered in that space beyond just our regular webinars, and members will still get great value from these programs. So yeah, very, very awesome. So this is, and we are talking about advancing healthcare excellence through education. And I don't know if you guys can see me blushing because I'm excited about what's going to come ahead, especially by the new year. There should be a lot of developments in this space. So we are discussing NIMART. If you look at the word NIMART, the N there stands for nurse, and then I for initiated, the M for management, and an ART, it's antiretroviral therapy. So we are going to be hosting a 5-day intensive HIV clinical management workshop for nurses. But in our previous experience, many other people attend, including pharmacists, clinical associates, because it's the most intense training in terms of basic HIV management. In September, if you're joining us and you're a clinician, in September, we are going to host the advanced HIV management course. It's going to be for 5 days. And this is what I've been doing in many other provinces. You keep on hearing me say, I was in Pumalanga, I was in this, you know. So we want to bring that intense program, very, very value adding for nurses who are already NIMART trained, pharmacists, clinical associates, and importantly, medical officers and specialists who really want to master the art of HIV management. So be on the lookout for that. But today we are discussing the nurse version of the basic HIV management course. So yeah, just to say you are welcome, colleagues, and this is the outline we are going to cover. From me saying welcome to everything else about NIMART and the actual workshop. And then hopefully we have time to engage. So feel free to type in any questions that you might have so that, yeah, I can try and respond. So, yeah, personally, I have a long history with HIV. If you want to learn more about my history with HIV, you must join us for these workshops because I tend to share real things, my own experience, failure points, which I had to learn from, but also my journey towards, getting involved in writing national guidelines. If you look at the last 3 or 4 versions of the HIV national guidelines, I am part of those people who are writing those guidelines and training master trainers throughout the country and disseminating, such information throughout. So I do share a lot. I mean, you can read this or that in the profile, but I think the main takeaway you must take from this summary profile is that I'm very, very much passionate about HIV medicine. I enjoy teaching it. And I enjoy seeing people who are a little bit not sure, a little bit resistant. By day 4, day 5, they're so bright, they are so excited because now they have a certain level of confidence in managing and supporting people living with HIV. So when we do announce these programs, please do join so that I can get a chance to impart and add value in your life. So you'd see this integration. We now talk about Aqua, the academy. We are taking what used to be called the Aqua Training School, which is one of my early initiatives. I have a very strong attachment to it because, yeah, there's no me without it. And because also it has impacted so many, 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 many people, in the HIV space. So I wanted to bring these two together so that, the impact can be big. And I think it's work in progress, but I think it's coming nicely as we cook it. So now we talk about Aqua. On the clinical care platform website, you do have a tab written Aqua, and we've put a number of programs there. And like I said, there's more coming your way. There's also a number of self-paced program, management of adverse event. We have integrated some of our master classes, cardiology, dispensing license, even the basic HIV management course is included there. All the diplomas are going to be run through the academies. With Dr. Makake, we are working on a diploma in dermatology. It's going to be the first, and I'm hoping that we really, really do our best to pull it off in the new year. Yeah, but there's a lot of work that's happening in the background. So just to tell you what the academy is going to be all about, right? Yeah, so what is NIMART? I think I've sort of explained that it is a nurse-initiated management of antiretroviral therapy. It enables nurses to start treatment. Remember, in most chronic disease programs, the doctor has to start treatment, and when the patient is stable, they are referred to primary health care to be managed further. But in this instance, if a nurse is trained on nurse-initiated management of ARVs, she doesn't need a doctor to start treatment. They will start treatment, monitor their own patients, support their own patients, do all the monitoring of patients, even manage some of the common conditions that may present with HIV. If the nurse is also trained in advanced HIV medicine, you would find that colleagues, you're able to hear me now. I hope so. Let me just see. Sometimes you'll find me talking alone. All right. I actually attended you won't believe this. I actually attended an online thing on leadership. I mean, we thought the speaker was coming. After 20 minutes, she came back and said, I'm done. We're like, no, but you were not there all along. So I'm just trying to make sure that I don't experience the same thing. It was quite interesting to see that. So yeah, yeah. So yeah, and then obviously it was a response because at the time when NIMART was started, just before 2010, the build up, it was the down referral programs where we used to initiate patients still in centralized hospitals. Then when they are stable, we send them to PHC just for monitoring and then for the nurses to send them back. But they were not necessarily well capacitated, the nurses at that point, because theirs was just to monitor patients and then refer them as soon as there's a problem. So NIMART came in around 2010, 2011, and then I mean the program is now huge. There's thousands and thousands of nurses who are NIMART trained. Every single healthcare facility, especially in the public health sector, has at least one, if not 10, NIMART trained nurses in hospitals. And if you look at the graph on your left hand side, this particular black one, you would ask yourself why between 2009 and probably around 2015-16 there was this rapid rise in the number of people who are put on ARVs. It's mainly doing away with a rather centralized system, mainly based in hospitals. Patients being treated by Dr. Bawela, who were thought to be maybe experts, but that had a lot of issues. People couldn't afford to go to hospitals all the time. And I think we lost so many people diagnosed but waiting for ARVs because there were waiting times, even guidelines in terms of access. You could only access this life-saving treatment if you had AIDS. I mean, people with very, very low CD4 counts. If you came with a CD4 count of 250, will tell you, no, come back after 6 months. But today we know at that CD4 count, someone could be having so many things. So whatever success we have in the HIV program, we owe it to our nurses, particularly our NIMART nurses. This is just how HIV is monitored in South Africa. This is an old graph. I could tell you a lot about this in my other world where I do advisory services on HIV care. This is the kind of work I deal with. But I just needed you to see that by July 2024, we had just the second pillar there, we had 7.5 million people who knew their status. That means they were tested and they knew that they are living with HIV. It's a lot of people, and just close to 6 million of them are being on ARVs. It's a program that still needs to improve because if you look at the people living with HIV, we're talking about 7.8 million people. only about 6 million. So there's like 2 million or so people who, at this point, who are not on ARVs. I know today there's a huge campaign by the Minister of Health and throughout the Department of Health and other civil society organizations. The gap has been closed. I think we're talking about 1.1 million people that need to be tracked and to be put on ARVs. So that is the goal. Just to sum it up, to say not everyone on treatment is getting their viral load. So we still have to improve that element. And if you look at suppression rates, below 50 copies per mil is around 75%. One day I'll present a full analysis around where we are, the state of HIV in the country, and I'll break it down for you. You'll see that even though we say we have put many people on ARVs, it's mainly women. You know, we have a huge gap in terms of treatment access for the male population. And we also, if you look at this particular graph, but for children, it is very dismal, very, very dismal. Very few children. I mean, there's huge gaps around testing children. Obviously, it's not easy to draw blood and those kinds of things, especially for the less than 2 years. Um, you know, a huge portion of children are not on ARVs, but there's a lot of socioeconomic issues. Remember, children rely on third parties for their treatment. And for one reason or the other, a huge proportion of children are not suppressed. You know, they are on treatment and they have high viral loads. And we know you cannot appreciate the benefits of ARVs if the viral load remains detectable. So this is what the NIMART program is all about. You need to appreciate what it has managed to achieve, but also appreciate the gaps, and that we will continue to need more and more human capacity to respond to these issues. So next week we have a 5-day program and it's end to end. You know, we're going to discuss everything you need to know about HIV, anything that has clinical relevance, which can help you to make decisions as you see your patients, from the natural history of HIV, understanding how to diagnose HIV. You know, it's not about 2 lines or lack of the second line. You could easily diagnose someone who doesn't have HIV with HIV, in as much as you could think someone doesn't have HIV when they do have. So we'll cover everything from adult guidelines to pediatric HIV, to how to manage pregnant women who have HIV, how to respond to patients with high viral loads, when to order a resistance test, but not like the way we do it in advanced HIV disease, because there we like spend a full day literally looking at resistance mutations and how to interpret them, etc., etc. You know, TB, HIV, management of common opportunistic infections, common side effects, and how to respond to them. By the time we finish this workshop, you'll be very happy, you'll be feeling very confident, and you'll be ready to do something from the next day. This is not just a theory type of a workshop, there's real applications, and we also introduce you to some of the tools that need to be used to complete, you know, your clinical information, but also for data reporting, you know, etc., etc. So yeah, do consider joining if you're not yet trained. It's a very good opportunity. And why must you do it? Because it's professional development. If you want to be better tomorrow, you must develop yourself today. We know undergraduate, for both doctors and nurses and many other people, there isn't a lot of HIV or time spent on it. And unfortunately, in clinical practice, a whole lot of people we see every day has something to do with HIV. You know, so you have to know something about it. We want you to improve your knowledge, but also it improves your career trajectory. Many nurses have found themselves working with NGOs in the private sector or becoming managers and supervisors of primary healthcare clinics because you are very competent in HIV medicine. Remember, HIV stretches the health system. If you can understand HIV, most likely you are likely to understand public health and health systems and probably be ready to run any other program out there. So yeah, we are looking forward to hosting you. Some of the things is, how will I learn practical skills? I can tell you there's practice from day zero. whether we are using MCQs, polling questions, case studies, group discussions, you are just going to be applying the theory right there. Will I get support? Yes, you will get access to guidelines. And also, we generally create communities, virtual via WhatsApp or within our platform, where you'll then won't be alone. So if by the next Monday you have a case, you can post it there. And yes, the program is accredited for 30 CPDs. It is aligned with the National Department of Health basic HIV management course. And if you miss a session, and because this is in person, you have to attend in person here in Joburg. It will be around Bryanston. You will then get an opportunity. Whatever you miss, you can actually go through our self-paced e-learning program, which we already have. So yay, Aqua is here, and we are here to serve you. I'm supposed to play this video. I'm gonna try and play it after here so that you can listen to Asanda. I can tell you, I did train her. Maybe it's more than 10 years. I'm sure what I know about her, she's now a very, very senior person wherever she is, from NIMART to quality improvement to becoming a QI advisor to becoming a program manager. So these are some of the people that really make us to be very proud of our work. You can see some of the feedback from people who felt that they were a bit intimidated maybe before they started, but as they went through the course, they have found themselves to be very, very confident. So we are excited to embark on this journey with you. This journey doesn't stop here. You have to do NIMART later on. You have to do the mentorship program. If you are already trained, have you done the mentorship program? Have you been assessed to be competent? If yes, the next step is to do your advanced HIV management course. If you have done that, the next step is to do your quality improvement so that, if you look at the nurses and how it goes up and up, you can then supervise groups of clinics and maybe run programs for your employer. So I think that is very important. So yeah, I'm gonna show you then how to register, but please note the email you can use to communicate with us. But I will come back to tell you. So also take a snapshot of this slide. I know maybe on your side it's not very, very clear. Let me zoom in there. Yeah, so if you have any inquiries, you can send us a WhatsApp. You can visit our website for registration. You can just drop us an email, info@clinicalcareplatform.com. And Miss, look at that spelling. If she was here, she'll be like, Dr. Mawena. But she's our team member. She's now responsible for client support or customer support. It's Imelda Nhleko. Some of you already know her. She's very, very patient. She's not like me. So you should be very happy that I'm not the one who's going to be replying to all your queries. But yeah, do that. Even now, just type in any questions in the chat that you might have. Also, let us know if you are interested or you'll join us when we run it again. It doesn't matter. It's good feedback. It helps us to think whether this is a program worthy of your time or not. If you want to register, you just visit our website. I'm now on the home page. There on top. If you scroll down on the home page, you should see our masterclass that's coming in this weekend. If there are any doctors here, neurology, dermatology, and statistics. And just below it, as you scroll down, you'll find the NIMART 5-day intensive workshop. So yeah, it's a workshop, and there was an early bird special. So I know that it's supposed to expire. Was it yesterday or today? I know it has not. So you still have like maybe a day. We will leave it up. I'll tell the team to leave it up maybe for another day. If you are really interested to join us, make that decision. And then so that you can get that special prize. So it's an in-person. That means we must book a venue. There must be welcome tea, lunch, and stuff. So most of the costs related to in-person events, they just go to the hotels and for your food, etc., etc. If it was on Zoom, I think colleagues though, we would have just kept it probably probably not even, I don't know, at half the price. So you'll either click on learn more there to then go to the course page An alternate way is to go to workshops. If you go on top there, there is workshops. You can just click on workshops there. Let's see if it's my internet is good for both Zoom. Yeah, you can see the neurology masterclass is there. And this is our 5-day intensive HIV clinical management training for nurses. If you click on those words, 5 days, or on learn more on the first page, it will then take you to the registration page. You can read everything you need to know about the workshop, how many CPDs, what exactly are we going to cover. You can see foundational knowledge, clinical management, specialized areas, and quality improvement areas, and what are the benefits of doing this program, etc., etc. And I'm going to be the facilitator. I don't like talking about myself, but if I was you and if you're attending, I'd be very excited because I've been training these programs for a while, and I mean, I was training the doctors the last 3 weeks, consecutive weeks on advanced HIV, and some of the concepts you just learn how to make them simple so that people are not intimidated by because the training is not about showing off, but it's about how can you make it easy for the next person to grasp these important things. So you can see that at this point the fees, it's 6,300 rands for 5 days. I think we are the most affordable provider for this program. Do shop around. If you find someone more affordable than us, I'll be happy to drop the price. Yeah, and then we are supposed to increase it to align with what other people are pricing this program at. So I don't want to mention names. Otherwise, yeah, if we are your preferred training institution, do join us, and we hope that you will. I forgot to say on the previous page where it says book your seat or register. If you click there, it will take you right here. Now, one of the benefits, if you want to appreciate, if you are a nurse and you are a member of the clinical care platform, you'll actually make huge savings. Right. For example, if you are an active member of the platform where the system says apply coupon code, you can just click on it there, right? And say, I'm a member 25. If you say apply, you're going to get a 10%. Look at that. You see, and remember, our membership, it's 1,200 rands for a year. You're actually getting your money back already. And this is applicable for all paid programs. If you are a member, you are most likely, there's only one because I think it's dispensing course where we don't have this because it's a collaboration program and it won't make business sense for us to do that. But all other programs, you can actually, if you are an active member of the platform, you'll be eligible for a 10% discount. Also note that if you think that after training for NIMART, you would need to do the mentorship program so that you get your competency certificate, because some employers, they would tell you on their application that they want a nurse who is competent. So not only have you done NIMART, but you have completed all the necessary number of cases, etc., to be assessed to be competent. We do have an online mentorship program which costs 2,000 rands there at the bottom. If you register for both at the same time, you'll actually save 500 rands right there. You see. So I think that from a clinical care platform point of view, we are really trying to make these things to be reasonable. They are not necessarily cheap or affordable, but I think you'll get a sense that there is more benefit for you at this point in time. All right. So yeah, I think I've showed you how to register at home or workshop. Just click learn more or something like that, and then you will be okay. Right. So yeah, let me go back to my Zoom and see if there's any questions on fire, burning questions. Give me a few seconds to get to the right screen. Yeah, can you make your slides bigger? Yeah, Shem, I know I used Naomi, tell me which slide you are interested in, and then I'm going to try and go back to it and zoom in. Please tell me which slide you are referring. Is it the website or what? And then I will go back to it. I'm sorry about that. To those who sent me WhatsApps and said, "Oh, you look tired last week Thursday. How do I look today?" I'm getting there. By this week Thursday, I think I would have fully recovered because yeah, I the last few weeks, training, and when I train, I can't train seated. I don't know if anyone has ever attended. I can't train seated, so I stand. I literally stand and walk around and talk to people. Sometimes it works, but yeah, sometimes it can be exhausting, right? So, Ahmed, thank you as always. I know Ahmed is always appreciating the work that we do as a platform. So, thank you, thank you, thank you, thank you, thank you. Colleagues also do give us feedback. I see there is a question. Let me zoom in and increase the size. Good. I hear you saying your membership is 1 year. Now that it's August, yes. So usually that's the question we usually get. So it's not there. It's just that we need to find a way to communicate this. I don't know. Maybe we should stop using the word annual and just say 12 months membership because you can start anytime. So if you start in August, your membership will lapse next year in August. And Cedric, just test it, especially if you are a nurse and you are working in the HIV space. As soon as you pay your subscription for 1,200 rands, I don't know if Dr. Makito is here, he will say it's 3 rands per day. You'll gain access to over 140. Actually, I think now it's more than 150 CPD accredited programs that you can, whenever you want to learn something about the heart, the kidney, there's a whole lot on HIV, PrEP, PEP. You will never be an outdated clinician. Whenever it's PMDS time, you can complete few and send the certificates for your for your for your annual bonus. I think I'll tell the team we need to find a way to communicate what we offer better because for me psychologically it doesn't make sense why someone wouldn't join the membership. I mean, you get so much. Probably in a year you'll get your money back if you join one or two paid events, but generally, I don't know. Yeah. We hope you join us, Cedric. Have no worries. I think you'll find that there's great value for you. Lindelwa says, how much if I want to learn online? It's probably half the price. I think it's 2,500 or something like that. Yeah. So if you want to learn online, and you feel like in person is expensive, but also because it's in Johannesburg and maybe you are far, because the cost to you if you're from far is probably high. There's travel, there's accommodation for 5 days, but my personal experience has been there's a certain group of people they will never learn online. Hence, we are just trying to to meet everyone's needs. Time will tell if we need to do this. Maybe we can even do a 5 day, yeah, NIMART online, and like we teach like this. What do you guys think? Give me feedback there in the chat to say, yeah, maybe via Zoom. But the problem if we do it via Zoom, you'll be seeing patients there, Zakel. You'll be there seeing patients with your earpiece in one ear. I know you won't take leave. Dispensing, the prices you are asking me. Melanie says yes via Zoom, and the price will probably be half because we don't have to pay the hotel. Remember, in person has a lot of issues. We must pay the hotel for every day. They even charge us for projectors nowadays. And then the food, welcome tea, lunch, and then no, there's welcome tea in the morning when you arrive. Then there's the 11 o'clock tea. Then there's the lunch, and the lunch there is buffet with with custards and stuff. After lunch, you can't even hear what I'm saying. You can't even hear what I'm saying because the custard is people are sleeping and I'm talking to myself there. Then before you go home, there's another tea. So if we do virtual, I mean, to be honest, that's why our master classes, we just keep the price as low as we can. So that more and more people can join. So yeah, no, not all says yes. Ramona says yes. Yeah, so it's something that maybe we I think I'll talk to the team and see if maybe the follow up one. It's a Ramona. Are you gonna take leave? Because when we do Zoom, Hey, people are there but not there. But I'm hoping you'll be there. You'll talk to your manager. Either they give you leave or they know that you'll. Yeah, it will be way low. It will be half the price. I can tell you that much because you see that's why virtual is so important. We eliminate all these unnecessary costs. Hi, how can we introduce NIMART in private? Well, I don't know about private hospitals, Audrey, but for the nurse, if you're working in the private sector, there are so many, especially males, they don't want to go to public facilities and they prefer to pay cash for their HIV care or for their health care. And most men, in any case, they have ways of finding money. I don't know about the value in a private hospital because private hospitals in South Africa, it's a specialist driven care, right? So as a nurse, you're not going to start anyone on any treatment in that setting. But if you are working in a private hospital and it is here, like you don't want to work there anymore, because most of the people I've trained, it's people who are working in private hospitals and they wanted to work at primary healthcare or public sector. It's one of the programs that if you do, you could easily gain entry into public sector. I also train many nurses who are in public, but maybe theater nurse. Maybe you are a theater nurse. Both theater nurse, and you are just tired of working wherever you are working, and you maybe want to go to PHC. If you do this course, you do IMCI, Integrated Management of Childhood Illnesses, and then you do adult primary care, you are good. You'll get the job there, and you should be able to do well. Yeah. So in person is costly because also yeah, so we'll see. I see yes to Zoom. We'll definitely attend. Yeah, please explain how the mentorship works. So mentorship has standards. You have to do a certain number. I can't remember it off heart, but our program is super aligned with that so that by the time you finish, you have done the necessary number of pediatric cases, pregnant women and stuff, and then you do a lot of OSCEs on this result is like this, what would you do and stuff. And then at the end, we do that. It's supposed to be a government driven program, but over the years, because of Donald Trump's money, though government's capacity has been really depleted because of over reliance on partners. Now the partners don't have money, suddenly, boom, everything has crashed. So those are some of the things. So yeah, so I think if you are around Joburg next week, join us for the week. And then to all those who said they would prefer to do it virtual, I'll talk to the team. Let's see what we can do as a follow-up on this one. I do know as well, if you are NIMART trained already, maybe you did it in 2010. We want to do a 1-day update. So there'll be like a full day and it will be mainly Zoom. Even if we do it in person, there'll be live streaming. And maybe even this one, we missed that opportunity to live stream it so that if you want to attend virtually via Zoom, you can still attend. So I think maybe we missed that opportunity, but it's good feedback, colleagues, that you are giving us right there. Yeah, let's leave it at that and then call it for a night. So thanks for all the feedback. Zakele, drop us an email, info@clinicalcareplatform.com. And then ask about the mentorship, and then we can send you more information. And colleagues, for any other information that you want, just do that. Let me just share one link for those who are interested. Okay, see you soon, guys. Night. Tomorrow, this week, we have 3 evening webinars. So from tomorrow till Thursday, we hope to connect with you. Have a restful one with your families. Bye.
Missed our latest webinar? No worries. We know life gets busy, but your professional development shouldn't have to wait. That's why we've created webinar micro lessons. Short, focused recaps of our full sessions designed to help you catch up quickly and still earn your CPD points. These bite-sized lessons are available exclusively to active subscribe members. So even if you miss a live session, you never miss out on the knowledge or the CPD points. Not subscribed yet? Now's the perfect time to join. get access to all future webinars, every micro lesson, and more, visit www.clinicalcareplatform.com to sign up